health and a little wealth and a lot of love.
All right, so the next segment actually ties very, very well with this one, Under the Microscope.
Under the microscope.
Under the microscope.
So we are kind of carrying on that last conversation into the data behind the cost of bariatric surgery. And so I just wrote down the kind of the average costs in the US and in Mexico, because I think they went to Tijuana. I think that's where she said she got it done. And so the average cost of gastric sleeve in the US is about $19,000. And the average cost of a gastric sleeve in Mexico is about $4,500. I think they said $4,500 to $6,000. And then for the gastric bypass surgery, which is a little bit more extensive, in the U.S., average cost is $23,000, and average cost in Mexico is $6,000.
Gotcha.
So you can see why some people who are desperate and can't get insurance coverage will turn to
the cost
to this option. Yeah.
Yeah, and so you say a bypass sleeve and then gastric sleeve, and gastric bypass. What's the difference between those two?
So I would say right now they are probably the two most common bariatric surgeries in the U.S. And so the gastric sleeve has gained a lot of popularity. The gastric sleeve, basically, they just kind of sew up they take part of your stomach away.
Right.
And so they're not rerouting anything. They're just taking away a portion of your stomach. And that allows to decrease the amount that you're eating. You know, when you eat more food, it makes you feel full. You don't want to eat large quantities of food, but it also, there's a hormonal method there too, where we talked about ghrelin. You love
ghrelin. And what I know about ghrelin is ghrelin's in the stomach.
Mm-hmm. Ow! It's produced in the stomach, and it is your hunger hormone, so it makes you hungry.
And so guys, if you have not watched, we did a whole episode of hormones, and we broke these down. And how we kind of do things here at Suits and Scrubs is we kind of play on each other, right? So we introduce a topic, and now we're getting more advanced topics. So all these things kind of playing together. So if you want to learn more about that, check out that episode for sure.
Yeah, that was one of our just recent episodes.
Yeah, and it's like Hansel and Gretel is what I was thinking. You know how they ate the little house and the little witch in the house? And whatever. Anyway, so you were talking about that stomach hormone.
So by removing a large portion of the stomach, you are also removing the amount of ghrelin that is produced. And so not only is it mechanical, so it's just you don't have the space to occupy the food, it also is hormonal. And so that's it. It works in both of those ways to help people lose weight. Whereas the gastric bypass is a little bit more extensive. You're actually taking part of the intestine that's kind of lower down and putting it at the front of the stomach, so that you're bypassing the stomach and you're bypassing part of the small intestines. And
so that way your body doesn't absorb the nutrients? Is that why? Or the fats and things like that?
It is, you're definitely more prone to malabsorption. So you're not absorbing the calories. There are also some hormonal implications there, but I won't get into all of the details. But those are the two most common types of bariatric surgery, and they do them both in Tijuana, apparently.
Gotcha. I did not know that. See, my brother was stationed in California, and they went to Tijuana quite a bit. And so what I know about Tijuana is definitely a good time. I'm not sure it's a good time to get surgery. So no offense. You may actually be, if you are watching in Mexico, you actually might be a great surgeon. Don't want to knock you, but I guess the message is do your research, and now we know the difference between the sleeve and then the bypass.
Mm-hmm. Yeah, yep, gastric sleeve and gastric bypass. Okay. And there are a lot of other details that would make you decide to do one or the other. The gastric sleeve, as it probably sounds, is a little bit more straightforward and simple. And so the time of surgery is usually not as long. So you're under anesthesia for less amount of time. The surgery isn't as complicated. And so it's a good option for people who might have a lot of other medical problems where they're an anesthesia risk, or you don't want to keep them under anesthesia for too long. You want to get in and get out. And that's what we see with, especially with severe cases of obesity. People have all of those end stage issues or comorbidities that makes them a higher risk for Comorbidities, which would mean other health conditions.
Defined. Say it again.
Other health issues. They have lots of other health issues.
Say that word again.
Comorbidities.
Comorbidities. Who comes up with these words? Can you put it in a sentence? Could you spell it? So tell me again.
Comorbidities.
Comorbidities. So that's just all the different other health issues.
Other health, yes.
And anesthesia, though, from my understanding, it's pretty invasive, especially for someone with comorbidities.
Well, you're
and overweight, I would imagine.
Under general anesthesia, you are putting people on sedating medications that can potentially lower blood pressure.
Right.
You're also putting people temporarily on a breathing machine and breathing for them if it's a more extensive surgery. But there are definitely complications involved for people who have heart disease, lung disease, especially if they have obesity, something called obesity hypoventilation syndrome, where they have so much weight that they're not able to breathe on their own. And so there are a lot of complications that can happen. I would say most of the bariatric surgeons in the US their percentage of complications are minimal when it comes to those severe complications, but those are just things that you want to think about. I know we kind of went down a rabbit hole, and we'll talk about it more later in the episode, but the gastric sleeve is more popular because it takes less time. It's more straightforward. So you would do that in people who might be a little bit more complex. The gastric bypass is better for diabetic patients. It can actually help manage blood sugar better and can reverse diabetes in a lot of people.
Yeah, and it sounds like to me, if you had the option and the cost was a factor, looks like the sleeve is actually a lot cheaper.
Yeah, it's
like $4,000, $5,000.
It's an option for
cheaper.
some people, but not all people, and some people require revisions. So we watch our fair share of reality television. We see people who have had some sort of bariatric surgery before,
like
and
My 1,000-Pound Life. Shout out to Dr. Now. I don't know if Dr. Now's still living. I don't mean but he's 80, 90 years old, and that man will go in there in that room and tell them, like, you're not eating the calories, you're making up excuse. He didn't play around, but he listened to him, but he did not play around.
He didn't.
Thank you, Dr. Now.
I don't know if he had the best bedside manner. He definitely was a tough love kind of guy.
Romanian, yeah. Something.
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.